Okay, so in this clip, I'd just like to talk a little bit about the first visit for children. Uh, Dental visits for children are a big deal. I know the predominant opinion is that baby teeth and they will fall out. Unfortunately, they're much more important to that. Neglecting dental care in very young children can often lead to dental infections. It can lead to problems treating them because with children we have to be so much more careful, and because they don't understand, we sometimes need to use sedation, and we don't take those things lightly. So ultimately, lack of dental care early on can lead to infections and problems that need to be treated in a hospital under general anesthesia, and that's not really how we think children should be cared for, especially with all the information we have in this day and age. The current statistics in Nova Scotia, despite that we have a fully funded program for children's dental care in this province, less than 50% of children by the age of 5 have seen a dentist. There are a number of reasons for that, but some of that may be because people don't know that there is coverage for their children, and that information may not be spread out as far as it should be. And of course, people are concerned about the costs, but again, with children up until their 14th birthday in Nova Scotia, as of 2014, the making of this video, children are covered. I mention the dates because this does change with time, but nevertheless, there is coverage for children. My sarcastic answer to when a child should first be seen is really before they're born, and the meaning of that is that really when a woman is expecting, the mom and dad can come in and get some pointers while they're getting their checkups. And the reason for that is the more times you hear some of this information, the better, because there really is some simple things that we can do for children and for families early on to prevent them from getting some serious dental caries and ultimately needing to go to the hospital over things that really could have been prevented in the first place. We'll record a separate little clip including some of those suggestions for the dental care for young children. Again, with this video is to tell you when to bring them in, and really as soon as you watch the video is, I guess, soon enough. The CDA recommends children being seen between 6 months and 1 year, so that's very young. Some dental offices don't accept children that young because there is very little we can do on a child that young. But what we can do is we can have a little look, we get the child used to the dental chair, and further than that, pass along the suggestions and ask some probing questions about what habits, healthy and unhealthy, are going on in the home to try and prevent problems with the little one. So another little clip I'll record some of the good and bad habits with regard to dental care of the little ones. Thanks for tuning in.